In 1992, the FDA put a moratorium on silicone gel implants. Not because anyone showed that they were dangerous, but just because there was an inadequate amount of data at that time showing that silicone was safe. But now, the data has shown silicone to be safe, and in 2007, the FDA reapproved silicone for general use. In the United States today, in 2010, about 2/3 of patients are receiving silicone and about 1/3 saline. But between the early 90s through the mid-2000s, patients were by and large getting saline in the United States. Now, one of the trade-offs with saline is they didn't feel as good, they would have more of a tendency to ripple, but they also could deflate. And the reason they could deflate is saline implants would tend to fold. You see, a surgeon was always touched with a dilemma with saline implants. If you left them soft, then they'd have to be a little bit underinflated and they'd get a fold along those within the shell, and you could get a micro hole in the implant near that long-standing fold in the shell. And since water is a small molecule, it just breaks and the water goes out. And as I was saying about the surgeon's dilemma, the other thing a surgeon could do is they would overinflate the saline implant. And you'd overinflate the saline implant to eliminate those folds, but then the implant looked really round and looked really hard. So, long story short, there are a lot of saline patients that are coming back to us today with deflations. And the typical story is a patient will say just over a period of a few days, one of their breasts suddenly and very noticeably started getting smaller. You probably don't have a saline deflation if you've noticed a very small change prolonged over weeks and months. Usually it's very demonstrable and very obvious over a period of days. If you are otherwise perfectly happy with your breast, you like the other implant, you don't want to switch that one over to silicone, you like the size of both breasts, you don't need a lift or anything else, all you really need to do is operate on that one breast and replace the saline implant. It's not a surgical emergency, you don't need to do it right away, but what I found is that patients that wait a while, the capsule around the implant, after the implant deflates, there's less holding that capsule out, so that capsule slowly starts to tighten up a little bit. So sometimes if you wait too long, we need to do a little bigger procedure to cut out that scar tissue of the saline, around the saline implant, so it becomes a little bit more to do than if you come in really early just after you've started deflating. But the big decision really to make is, are we really going to focus on just that one implant? Or are you going to say, gee, you know, it's been 8, 9, 10 years. If my right just deflated, I don't want to do surgery today, and then next week have my left deflate. So do I want to do both sides? And then if you're doing both sides, do you want to change the silicone? Do you want to change your size? These are the kind of things that you need to think about. But saline implant deflation is a common issue, and I and many other plastic surgeons are very experienced and should be able to answer all your questions about it.